Pleura and the pleural spaces. The pleura is a thin transparent serous membrane enveloping the lungs and lining the thoracic cavity. One is the visceral pleura and other one is a parietal pleura. In between is the pleural space. So what is the visceral pleura? Pleura surrounding all surfaces of the lungs merges with the parietal pleura at the root of the lung. And if you see the parietal pleura, pleura lining the chest wall, diaphragm and the pericardial sac is called as parietal pleura. And the applied physiology of this. Only the parietal pleura receives innervation by the general sensory nerve fibers, and only inflammation of the parietal pleura, that is pleuritis, will result in the pleural pain. And the parietal pleura is innervated by the intercostal nerves and the phrenic nerve. And this pain is referred to the chest wall and to the root of the neck, and visceral pleuritis is clinically silent. The pleural recesses are the spaces into which the lungs expand during inspiration. And the first one is called as the 𝐒𝐫𝐴𝐷iaphragmatic recess. So the 𝐒𝐫𝐴𝐷iaphragmatic recess is the space between the diaphragm and the costal pleura below the lungs. And the 𝐒𝐫𝐴𝐷 recess are the spaces between the costal pleura and the mediastinum, that is anterior lungs expand into these spaces during inspiration. So what is the radiological aspect in this? The 𝐒𝐫𝐴𝐷iaphragmatic angle is formed by the air or matter interface when the lung and the domes of the diaphragm. 𝐒𝐫𝐴𝐷iaphragmatic angle is formed by the air matter interface between the lungs and the domes of the diaphragm. It is usually sharp and very crisp borders. Blunting of this angle occurs in pathological conditions causing pulmonary edema such as congestive heart failure or acute respiratory distress syndrome, or complications of infections with parapneumonic effusions, or any fluids in the pleural space that accumulates in the 𝐒𝐫𝐴𝐷iaphragmatic space when the patients are upright position. The pleural space is normally a potential space which can become compromised in certain conditions, like if you see pleural effusion, accumulation of the fluid in the pleural space, that can be a transudate. For example, if you see the transudate which accumulates because of increased hydrostatic pressure, and there will be a decrease in the oncotic pressure, mainly in the conditions like congestive heart failure, cirrhosis, nephrotic syndrome, for example, all other conditions which may cause the transudate to accumulate in the pleural space. And next is the exudate, is a protein-rich fluid which accumulates due to inflammatory causes. And next is the pneumothorax, which is air accumulation in the pleural space, can be spontaneous or complication of chest trauma. And chylothorax is the lymphatic fluid accumulation in the pleural space, and most commonly a complication of the malignant process, that is lymphoma or sometimes secondary to trauma. Hemothorax is the blood accumulation in the pleural space and most commonly caused by chest trauma. And at last is empyema, is a complication of pneumonia where the abscess formation occurs in the pleural space. So this is what you need to know about the pleura as well as pleural spaces.